At the moment, most infant formulas are cow's milk based, but some formulas actually have prebiotics in them. And thereby, if we looked at all the studies that randomized to one group which has prebiotics in it, and the other group that doesn't, what they found is that with infant eczema, the chances of getting it is much less. My advice always is to breastfeed as long as possible, because breast milk certainly is shown to decrease allergies long term. However, if you cannot breastfeed, then choose a formula that may well have immunomodulation effects. And one way to immunomodulate or change the gut flora is using prebiotics. Now, prebiotics is a oligosaccharide, which means a complex, non-digestible fiber. What we did is looked at all the different types of combinations of prebiotics in these studies, and there are different ratios. What we found is that the ratio of a short-chain galacto oligosaccharide in the ratio 9:1, and 1 being the long-chain fructose oligosaccharide, that ratio seemed to be the most beneficial. Some other ratios doesn't seem to have any significant benefit in terms of decreasing eczema.
The most important way of establishing whether a child is at risk is by taking a good family history and looking for a history of atopy, including asthma, eczema, hay fever and allergies in first-degree relatives. We know that even healthy children have a 20% risk of developing eczema. That risk increases up to 80% when both parents have a history of eczema. We also know that within that, certain racial groups have a higher risk, and the Asian population in particular is one of those groups. We know that for establishment and maintenance of a healthy immune system, that the balance of good and bad bacteria in the gut is very important. The role of prebiotics in that process is to act like a feeding ground for the good bacteria and ensure that balance is maintained. We know that prebiotics are found naturally occurring in breast milk, but sometimes mums can't breastfeed, and we know that a specific blend of prebiotics found in certain infant formulas can also be very effective in reducing the risk of eczema down the track.